One of the sayings my mentor always said during my fellowship is happiness comes from within. What he basically means is that a facelift's not going to give you happiness if you're not already happy. It's not a cure-all. A rhinoplasty is not going to make you happy if you're inherently not happy. Not saying that people don't have depression. I operate on people all the time with depression or that have some battle with happiness. But if they're inherently unhappy, that is a problem. I can get a red flag during a consultation when someone comes in, they don't make eye contact with me, they are downtrodden and unhappy, and they're looking for plastic surgery to change their life, and it's not going to do that. There is, in the world of sort of psychology, in terms of motivating factors, they talk about external versus internally driven motives. So an external driven motive would be, well, I want to get married and therefore this will help me get married. And again, it's not a problem that if you think, hey, if I knock out my waddle, I'll be more competitive in the dating pool. That's okay. But if you said, look, if this doesn't go away, I can't get married. Or if I get this, knock out this waddle, I will be able to get married. That's why I'm doing it, because I need to get married. And what if you don't get married? Well, then the plastic surgeon gets the brunt of it, and you're unhappy, and that's not a good thing. So if you're externally driven by a motivation of of doing something, it can be problematic. Internal drive is, I don't like the way this feature looks on me. It's been, something I've been bothered by for a long time. It's something that is important for me to change, just to be, what I would make to make me a little bit happier. Not to say this would make my happiness, but it would be something that would help me feel better about myself. So motivation is important based on sort of internal motivation versus external. And again, external motivation of saying, look, I think I could be more advanced in my career, or whatever it may be, is okay so long as you don't link it to the outcome. So if I do a rhinoplasty, I must get this job offer. Or if I don't get it, it's because my rhinoplasty wasn't good enough. That kind of external linkage creates a lot of stress for yourself, for the surgeon, and it's not a good way to really motivate yourself to have something done. It should come from inside. The second part is, I alluded to it earlier, is the chronicity of time. If you just thought about having a rhinoplasty because you saw something on Instagram last week and it never crossed your mind before, that whimsical nature of not having enough deliberation is also not a good sign. But if you've been thinking about it for a while, maybe done some research on it, really contemplated whether it's a good option for you, then that is a good sign. Someone that's had some time to mull over it, think about it, the motivations are internally driven, then those are the signs that help you. So if you are not inherently a happy person inside and you're looking for plastic surgery to change your life and give you the golden ticket for a new job, a new spouse, whatever it may be, or just to overcome your depression, don't do it. It won't do it. It will not help you. But if you're already happy and you're already stable, again, doesn't mean you have no depression. Normal to have some depression in one's life, to be on antidepressants. But if you understand that it's not going to change your life, it's just one thing to help you achieve your goals, then you could be a very good candidate for cosmetic facial surgery or hair restoration.